Okay, so here I am, pelvic floor botox injection coming up. It's like my 15th one or more. So we're just doing it right in the doctor's office. There's no need for an OR. There's no need for procedure room. We're just doing a pudendal nerve block, and we're going to do one unit instead of two. Normally do two. He's got a resident with him, and we're just going to go through just so it can be done right in the doctor's office. So anybody in the States, you don't need to be paying for OR time. And we'll show you how it goes.
Take the middle part of the spinal out and toss it in the sharp, watch out, and flip it. And then we're going to cut the, this is just like the makeshift pudendal block kit. There's actually a kit that has like a trumpet to help guide the needle, but they've been discontinued, so we don't have them anymore. So I basically just withdraw the needle back like a centimeter-ish and cut off the tip. And that way this provides like a sheath to go into the vagina, and then we can push it out, so it protects as we're going in.
Mm-hmm.
That's what we're going to use for the local and for the Botox. We'll draw off the local first, and then we reconstitute the Botox and sterile saline. Use 10 cc's of either 0.2, usually 0.25. She gave me 0.5 today. That's like a 0.5% to be Pelvic with Becky on both sides.
No, we probably only need to do the...
Do you not want to do it today?
No, I meant that the left side, probably only need to do the left side. That's only where we're putting anything, really.
Okay, I have put...
We can do both.
In the past, I've done quite a bit. Like last time, I put most on the right side.
Yeah, that's what I mean. I thought were you talking about...
Are you wanting to focus?
No, I meant for the pudendal nerve block.
So for the pudendal block, I usually put on both sides.
Yeah.
Just because the nerve, there is like a nerve distribution kind of cross over a bit.
Yeah, it's not a big deal.
So that's that one. So we can do that first, actually, if you're ready. That's all ready to go. Okay. And then I won't reconstitute the Botox till we're ready to go. So
okay.
If you want to get in position,
it's right there.
Okay.
If you kind of go down a little
here.
bit. No, maybe back up. If you go in just a little bit deeper, yeah, right there.
Yeah.
That's where it's acting up.
And the left side is always less, right? Like
yeah, we haven't had a problem there in a long time.
Yeah. Is this tender when I press on the left side?
No, right there. Right
here.
There, it's a little.
Okay. And the neovagina does kind of like deviate off to the.
And if you just kind of go right, if you go back just where you were.
Right
now,
here.
if you go, just drag your finger like this, but to this side, right in that area, right underneath.
Okay, in that U shape. Okay.
Yeah, that's where that's it. That teardrop.
Yeah.
That comes down and over. Okay, now that hurts.
Sorry. Yeah.
Do you want to put that up?
It's okay. I just kind of tried my back and it's not good. Yeah.
Seems like a great long-term plan.
Yeah.
See, this is the part where you start asking for the nerve block.
Okay. So pressure.
A
little bit straighty. I'll put the freezing in first on the right side.
Yeah.
So just a little pressure. It might just feel a little bit strafey when the sheath is going inside. I just kind of use my finger. If you want to see, I use my finger to just block because the sheath itself is a little bit strafey. And then just get it down to the tip of your finger. And then the sort of classic thing with the pudendal block is like you're going out like this, sort of towards the obturator internus and ischial spine. And then, okay, 1, 2, 3, poke. Sorry.
That's all right.
I'm just going to reposition in one more spot, just in case I missed it the first time. Poke. This freezing tends to work really well for Stephanie, so we always do it. Even if it's not getting exactly the pudendal nerve or all branches of it, like it seems to help reduce the pain with the subsequent injections. So.
One of those
Sorry.
It's alright. It's mostly numb now anyways.
Okay. Yeah, I'm actually kind of happy to see or feel that those that muscle at the base is actually calmed down quite a bit. Like the one that the transverse perineal muscle is right down here. This one isn't bleeding. I'm just gonna put a gauze there.
Yeah.
So I'll reach out the rest of it here. Thanks. This one, because the vagina kind of goes off to the side, I probably am not getting the best block of the pudendal nerve, but I think it still makes a difference to do it, especially if you're going to put some botox around that area. Okay.
How much do you use to reconstitute the botox?
10 cc's.
10 cc's. So no, one of these.
Yeah, I actually use, so the reason I get 2 is so that we don't waste any, so I'll end up putting probably 12 or 13 cc's in.
Okay.
Just because there's always a little bit of dripping and stuff, so it's nice to have a little bit more volume to work with.
Mm-hmm.
Yeah.
Okay.
Maybe as you can do for the left side, or your left side. Yeah?
Yeah.
Okay. So just pressure. Sorry.
Sorry. Oh.
You doing okay?
Yeah.
Okay, so that's all the freezing.
So
Doing a little bit more than usual. I'm just going to put a sponge in
Yeah.
there.
that would hurt a little bit more than usual.
Yeah.
Usually it's like I count down 3, 2, 1, and usually by that time
It starts to go away.
it starts to go away.
Yeah.
But it was flaring up a bit when I came in, so that usually has something to do with it too. The more it hurts when I come in,
Okay.
the
Are you
more
feeling
that
like there's a little bit less
pain.
yet,
Yeah.
or- yeah?
Yeah. Well, you can feel it kind of.
Work its way down?
Yeah.
Okay. So now
Should
we'll
we
just,
reconstitute right here?
no, so yeah, reconstitute essentially. Do people do Botox injections in Newfoundland, or does Shwani, or?
Our Eurogynes do it
Yeah.
intravesicular Botox.
Just, that's for a different problem, though. That's for the bladder.
Yeah, but nobody really does.
Pelvic floor. Okay.
That I'm aware of.
Well, that's what we're trying to get.
Flip it so down a little bit. If you flip this sort of like that, and then I'll try to get a little bit more from the second one. See what I mean? Like we got 8 cc's there. Okay. Perfect. So yeah. Do you trust me? Okay. Okay. So. That's really important. It's kept on IEC as well.
Mm-hmm.
Just spin, spin, spin. Spin, spin, spin. And it's got this viewing window, so make sure it's good to the last drop, so you see the window there. So put the needle down right at the base and get everything that I can. Sometimes it doesn't love coming out. Almost there. Okay. Be careful, don't take the plunger out of the syringe. Okay, there we go. Okay. Okay. So ready as you can be?
Yeah.
Yeah. Okay. Okay.
I don't know how I get much more ready.
So we can do you want me to do, in the past I've used the spinal needle to get to some of the deeper
Yeah.
muscles, and it is a thicker needle. It causes more bleeding, but it also gets us to the deeper muscles.
Yeah.
Do you want me to start with the spinal needle, then we could use some of the smaller needles for the more superficial injections?
Yeah,
Yeah.
we can do that.
So if you can find the smallest gauge needle that there is in there.
Is that the bag I brought over? There should be some 30 gauges in there.
30.
That would be a 30.
That's a 30.
Okay, so we can use that.
That would be good for the vaginal canal because the pudendal nerve block doesn't numb that. I put numbing cream in there,
Okay.
so it should hopefully be a little bit numb. But I mean, the 30, it doesn't hurt, just that little prick.
So I'll put some of the Botox in. We're gonna focus most of it in that, like in the colon, like in the vagina, in that sort of teardrop shape, and kind of coming in towards the entrance and a bit up the left side. But what I'll start with is just putting like probably 3 or 4 cc's like deeper in those muscles that we know are always a problem.
Yeah.
Deep in the left side. Does that sound okay?
Yep.
Okay. Sorry, that's my band there. Okay. So, does it feel a little bit numb?
Mm-hmm.
Okay.
I'll, you know.
Okay. So I'm gonna go kind of like, can you feel that still or not?
Just pressure.
Okay. I'm gonna go kind of in that area. So I'm just gonna guide this along my finger, being careful not to poke me or Stephanie. And you just inject it an aliquot, so sometimes as little as 1 cc or even less. In this case, I'm going to try to get some of the deeper levator bowl.
Feel that a little bit.
Okay. Sort of where I think the obturator interna is maybe or closer to where that is. And then one sort of deeper down in that more center of your teardrop on the vagina, where I'm not going to be able to reach with that smaller needle. Okay, and then the rest we'll use with the small needle.
So in that first one, you can feel a tiny bit.
If you're, so I mean, are you okay if Emma does these ones? That they're just a smaller. So we're just gonna go. So just get one finger with a little bit of gel here first, and just feel, so the muscles are very tense. Just
Kind of here.
yeah, just like about this far in.
Yeah.
A couple centimeters in.
Is that the right spot, Steffi, that you can feel?
She
You
can't
know,
feel
I
it.
can't feel anything
anything
now.
anymore?
No, I
That's
can
good.
feel.
It means the freezing did
That's
its
good.
job. But just kind of right around there, and I'll just show you just with my finger. So put some in along here, along the neovagina. So just like little aliquots along this way, and then also where you can feel a ridge right here. So get some definitely in that ridge, and up here as well.
Yeah.
So kind of like right around here on the left side.
Ironically, what it is now that it's numb, when you touch it, I can actually feel where that ridge is.
Okay.
It's weird. It's almost like feeling your arm. It's soft and bone.
Yeah.
It's almost like that when you're going through it, soft, and I can feel when your finger hits that
spot.
hits those spots. Yeah.
Yeah. You just kind of keep on going. It can be multiple small, especially with that 30 gauge needle. It can be multiple small injections, because the idea is we're trying to spread it out and get into the right spots that we need to, which we're not 100% sure, but we sort of based on our feel and based on our symptoms, we're making decisions about where to put it. And then once it's all in, we're going to massage it in a little bit.
Okay, so I put a couple here on this one side and a couple on the ridge.
Yeah, we go at 6 o'clock and now go out sort of like
Kind of here.
3 o'clock, yeah. A little bit deeper there, yeah. It doesn't go as, it's funny with such a small needle, it's like you can inject, it feels like you're injecting more because it's such a small amount that comes out each time.
It's a grip strength test.
And I would put the rest probably just deep on the left side, or on her right side, on your left side. Yeah. Just with the rest of what you have. Yeah. Good. And then you can just gently massage it in, just kind of back and forth with your finger like this.
Now, did you put any in the vaginal canal?
Yeah, that's what we were doing.
Oh, okay.
Yeah, you can really feel it, I guess, but yeah, that's where we were putting.
Yeah, okay.
Yeah.
I'm not sure how far in you can, if it's going to spread all the way through or...
Yeah, well, just here, we do a little bit more than that. So,
Okay.
just some deep massage here. You can kind of feel the blebs where I put the low flow. And just really try to work it into the muscle. Okay, good. So I'm just gonna gently wipe here. Looks like most of the bleeding stopped already.
So this whole thing goes straight, yeah?
Yes, yeah. Okay, we'll get you on the spot laid. Do you want a hand up, or you?
I'll be good. I'll just need a pad, though. That's definitely.